the bags of the things, and there's scoops of this and scoops of that, and
Right.
then that's the treatment for that. And
Yes.
the variables, I mean, it's almost infinite. Welcome to the Dr. Gill Show. This is where we talk about medical matters that matter to you. My returning guest is Dr. Sue Overkamp. Welcome back to the show, Sue.
Thank you, Gil. It's so much fun to be here.
Sue is a friend of mine. She's a local physician here in Columbia, Missouri. She is the founder of Door to Door Medicine. Sue is triple board certified in family medicine, osteopathic manipulation, and acupuncture. She's just a wellspring of information, and we've spoken about a number of topics. This is a topic I've really been looking forward to chatting with you about, Sue, and this is herbology. Herbal medicine, Chinese medicine uses herbs quite frequently. Herbs have been used throughout human history, throughout all cultures, and there's still a role for herbs in Western medicine.
Indeed.
In Europe, they still have apothecaries, and I know in France, in particular, a lot of pharmacies. There's some that are like almost exclusively herbs. It's a really big part of medicine still in many cultures. It is, yes. So you use herbs in your practice.
I do.
Informed from both Chinese and Western perspectives. Mm-hmm. So give me an overall perspective, Sue, on herbs, their uses. This is a huge open-ended question here. Their uses, when you would use them, how you would use them. Give a shot at that.
How about a case?
I would love a case. We do this, by the way, in medicine. We frequently use cases. We'll use a particular case because it hits on all these different subjects and allows you to put it all together. So it's a way of teaching that's time-honored.
So I have a lovely patient who was really suffering quite a bit from what people call postnasal drip. So, and this, I guess I started seeing her for this in January. She was very disturbed by it. It was constant. She was always having to clear her throat, miserable sinus pressure, frontal sinuses, maxillary sinuses, and just, antihistamine wasn't cutting it. Of course, a patient like that who wasn't on antihistamine, I'd probably put on one. But she was already doing that. It just wasn't working for her. So I added a Western medication to her, and that helped kind of get her over the worst hump. Mm-hmm. But then she came to me and she said, she could only be on that medicine for 10 to 14 days. She came to me and she said, I've still got this. And I said, and I understand, looks like it's probably allergy, because allergies start in Missouri in January for lots of people.
And end in December, yeah.
Because eastern red cedar blooms and, all heck breaks loose and people are like, what's wrong with me? It can't be allergies because it's cold outside. I'm like, yes, it can be allergies. And it is allergies. So when it is allergies, that's what I say. And so I started talking to her to see her interest in and her readiness to make some dietary changes and maybe use some herbs. So I recommended that she make a tea from whole fenugreek seed, whole flax seed, and shredded marshmallow root. And everybody's familiar with flax seed, or well, most people are. It's a thing you can buy in the health food store. Fenugreek seed is in both the Eastern herbological pharmacopoeia and the Western. It's a really old herb. And it's the thing that they use to make artificial maple syrup taste like maple. So when you smell fenugreek seed, it smells like maple. It doesn't taste like maple.
But it gives the
it smells
the aroma.
like maple. So that seed, the flax seed, and then marshmallow root is an herb. You take the root, and the reason why you shred a root is because roots Usually you have to decoct to get the so-called herbal virtue because they're very fibrous and they don't yield up their constituents as easily as leaves, flowers, and other softer parts.
Yeah, it's
of
called
plants.
a decoction. I've learned that.
Yeah, so usually you have to decoct roots. So you would shred the roots so it's easier to get the virtue. And most of my patients, I think, are not really patient enough to decoct their herbs. So I teach them how to infuse them. And infusing is just to take the herbs you're going to use and pour usually boiling water over them. What people think of as herbal tea is actually an infusion. It's an herbal infusion. And tea, real tea made of Camellia sinensis, Chinese green tea, is also an herbal infusion because you're infusing parts of a plant. So not everything is tea, but all teas are infusions.
Or infusions. Gotcha.
Okay. And decoctions then are you actually have to simmer, slow boil it because it just takes more oomph.
Yeah, more time for the chemicals to extract.
To be released.
Now, do you add alcohols or solvents or something for tinctures?
I do not do that with patients who are using herbs at home. I do prescribe tinctures to them. I often use like extract of lobelia inflata or extract of milk thistle or different kinds of extracts.
Maybe we can get to those in a bit, the tinctures and the extracts and these decoction things. So let's get back to our patient in hand here.
Patient,
so you had,
she was interested in finding out how to get fenugreek seed. I told her how to do that. Flaxseed is easy, and then how to find the marshmallow root. And she was able to get those things, and I told her how much to use to make a pot of tea. And that when she had her cup of tea, that she could then let it steep longer and it would get stronger.
Sure.
And then she could just add water to dilute it so that it was a good flavor for her. And this helped her some also. It didn't absolutely do it for her. So then we started talking about her diet and we tested her gut. So all these things kind of came together for her and she's feeling a whole lot better.
In the totality.
Right.
Of things. A little bit here. I call it nibbling the edges. Help this,
nibbling the
this,
edges.
help this. That's how I treat a lot of conditions.
Yeah, when you have something that looks monolithic.
Right.
Chewable chunks. Right?
You eat an elephant. Yeah,
chewable chunks, yeah.
One bite at a time. Very good.
One bite at a time.
And I'm just curious how seeds would be a good tea. It seems to me a seed would have a resistant shell on it, and the stuff wouldn't come out. You'd need to grind it up first.
And I do tell her to get a whole seed, because once you grind seed, whatever oils are in there are exposed to air and become rancid. So when you buy a ground seed, unless it's been kept refrigerated or frozen, it's rancid.
Gotcha.
So you could take your seeds and put them in your spice grinder and then make tea out of them.
Okay.
Or you could just let it steep for longer.
Okay.
You could also decoct them.
Okay.
She was getting a good enough result with what she was doing infusing. I like to not overload the patient and have her learn all kinds of things about herbology right away. Just try 1, 2, 3 herbs. When you combine those 3, it's dynamite for getting rid of mucus. And the main effect that it has is in herbal medicine called demulcent. And what that means is fenugreek seed, flaxseed, and marshmallow root actually help the gut to stop being as irritated. And it's slick like mucilage. And so when you drink this tea, when it's hot, you can't tell the slickness. When it cools, though, you really can. The seeds get really slick and the root gets very slick, slippery, and it actually coats the gut and helps the gut. And this is the gut relationship to the sinuses. So when the gut's not irritated, the sinuses can stop being irritated. It's a different way of thinking about how to approach a problem.
Yeah, so you've got this, a great word is armamentarium. That means all the different tools at your disposal.
Right.
Right, so
So
she had
mucus where it doesn't belong and mucus where it does belong. You're trying to get the body to go back to balance.
Well, maybe we can go to some other common conditions that you might treat with herbs. So let's continue this investigation here. So what's another common problem that you would see that you would also consider herbs?
Constipation would be one.
There's a great one. I see a lot of women early in pregnancy. A lot of women I treat have we give them lots of progesterone, which is a constipating thing.
Right. And a gentle unconstipator is that exact same combo I just told you.
All right. Oh, so that same or the slickness.
You're coating the gut. You're help soothing the gut. If it's a really long-standing serious constipation, that herbal combination isn't going to work. There is an herb that probably would work, but it's too harsh. I don't usually use it. It's called senna.
Oh, senna, yeah. They've been using that for years. It's part of
Senecot. It's a medication that we give people, but it's fairly harsh.
Yes.
So I tend to do other things with patients with that kind of constipation than use herbs right away. But once the constipation is starting to break up, now that's a field day for herbs because we have to actually rebuild the gut in a sense. Mm-hmm. It's not meant to retain the stool like that.
Right.
And having the stool stay in there is very, very burdensome.
Yeah, it's toxic.
Gut.
It's just toxic.
It's toxic. It's irritating.
Sure.
And so we want to help heal the gut. And there's lots of things that help heal the gut. Peppermint is a great gut healer for many people. And it is also helpful for the nausea of pregnancy for many people.
Peppermint.
Yes.
Is that different from just regular mint?
So mint is a family, Labiatae.
Okay.
And it's huge. I mean, there are hundreds of mints. So when people say regular mint, they often mean spearmint. And yes, peppermint is actually a cross. It's a hybrid. So that if you try to start peppermint from peppermint seed, you won't get peppermint, you'll get spearmint. So it's kind of a way cool thing I don't understand a whole lot about. But so spearmint is also helpful to the gut. It's just that most people who are actually having more of a small intestinal problem, peppermint is very soothing for that. Mm. Chamomile is a very often used herb for gut health, for sleep.
Yeah, I see it almost every different herbal tea I've ever seen. Chamomile seems to be in at least half of them.
I don't use it because it's in the same family with ragweed, and I am terrifically allergic to ragweed. So I don't use it. It upsets my stomach rather than soothes it. And I thought, what's up with this when I was a young mom trying to learn about herbs? And that's what's up with it. So for many people, though, it's an excellent herb.
For gut health.
Yes. And when people are trying to learn about herbs, I recommend that they start with one, like fenugreek seed.
Okay.
A typical scenario with a person wanting to learn about herbs could be a parent of an infant. And so fenugreek seed is very mild. It promotes lactation for most people.
Yes, I remember my wife trying that.
Not me and my daughter, but most people it promotes lactation.
Right.
And little babies who are breastfeeding cannot afford to have a stuffy nose because they have to be able to breathe in and out their nose while they're nursing. And so a nursing child with a stuffy nose, nobody's happy. But you can take fenugreek seed tea and pour it into the baby's bathwater, and it'll go in through their skin.
I'll be darned.
And the mother can drink the tea, and it'll go into the milk. So start with one. Start with just peppermint. Learn how to use it. Start with fenugreek. Learn how to use it. build one by one by one. And then the true art of herbal medicine is herbal combination, to be able to combine herbs that have different but synergistic effects. And this is where I wanted to bring up about Kerry Bone. Kerry Bone has his master's.
This is a person. This is the name of a
herbology.
person.
Yes.
His first name is Kerry.
He is Australian, and he has written a beautiful medical textbook size book called Phytotherapy, which means therapy with plants.
Yeah.
In other words, herbal medicine, okay? And in that book, he says the reason that we don't get the kind of results when we're studying herbal medicine that we expect to get, like when we're studying pharmaceuticals, for instance.
Right.
I'm going to interrupt myself and give an example.
Okay.
They do study after study after study of Echinacea purpurea as, it's supposed to help abort a cold or boost your immune system. But they keep studying and they're like, well, we don't really see any difference between the controls and the test subjects. Well, Kerry gives a reason that I think is actually right on why we can't really study herbs scientifically yet is because in even a single herb, never mind combining two, you can have up to like 50 bioavailable substances in this one and 15 or 20 in this one. And to study all those synergies simultaneously is not a thing that science can do yet.
We can't do it. It's too many variables. And also, I happen to have met a couple of guys, I think they were in Oregon. They had an echinacea farm.
Yeah.
And they said this was years, 15, 20 years ago I met them. They said the way they grew their echinacea was a lot more powerful. It had a lot more of the active ingredients due to their, they loved on their echinacea. They fertilized it, watered it, and whatever they did.
They studied
their
how to
echinacea is
optimize
better.
it.
Yeah,
right?
they said they had a better echinacea. It's not all the same.
It's not all the same, and it only works for 5 days. So don't try to use echinacea longer than 5 days. It'll boost your immune system for a short period of time. Using single herbs is almost never the optimal thing to do, particularly when we start treating illnesses with them. You need to combine herbs to get that synergy that helps balance each herb so that they work together, each doing different things.
All right, I guess give me an example then. What are herbs that you would combine? I'm sure we could go for hours and hours,
so
but give me some highlights.
Three combo to start with.
All right.
And the greatest, I'm not going to poo-poo Western herbology because it's amazing.
Right.
But Chinese herbal medicine is really, really old. And they'll put, sometimes 4 ingredients, sometimes 24
herbal
I've seen
ingredients videos
of single formula
of the bags of the things, and there's scoops of this and scoops of that, and then that's the treatment for that. And
yes,
the variables. I mean, it's almost infinite. But
so there are some commonly used, like most often used, herbs in Chinese medicine. But what's important about using herbs in a Chinese medical context is that a qualified healer or doctor in Chinese medicine would first evaluate the patient. And then when the Chinese diagnosis is arrived at, then that's going to guide the person treating which kinds of formulas might be most appropriate for this patient. Mm-hmm. And so it's impossible for me to say when a patient walks in the door what Chinese herbal medicine I'm going to give them. I have to ask them the 10 questions. How are you sleeping? How are you eating? How's your sex life? Are you resting? Are you fatigued? All those ordinary things that we ask also in Western medicine, right? And then to listen to the pulses, to look and do a tongue diagnosis, and just to see the general quality of the patient's skin. Like, I don't know if you can see this, but My eyelids are very white over my eyes. They're always like that. Do you see that they're white?
Now that you pointed out,
that has to do with the lung qi. I have a lung qi issue, okay? And so this white.
Now I can't unsee it.
Yes, right.
Now I'm seeing your pale lids.
This white eyelids is a sign that there is a lung issue. And then a face that's too red with a red tip. This is a person we want to make sure that they see their cardiologist. We want to make sure that they understand how to eat a true heart healthy. And then from a Chinese medical, we might need to support the heart yin for this patient. And so we would give a heart yin combination for them. And there's several of them. It is quite a science and an art and a practice to be using herbal medicine.
So let's do another case then. What is another common condition that's going to use some different herbs, different from the ones we mentioned?
Let's do hypertension, and with it,
or that's high blood pressure for
high
those.
Blood pressure and hot flashes
together.
Yes, because they both in many people, and I'm not going to say this across the board because a person can have hypertension and not have liver yang rising.
Okay,
but many do. And almost all hot flash people do have the same Chinese diagnosis.
And this is generally women going through menopause.
Right.
Okay.
So I would almost always, and I would look at the liver pulse. I would look to see if they had a sallow complexion. That sometimes has to do with the liver qi. And I would treat with acupuncture, and I would give them an herbal formula called Jia Wei Xiao Yao San. And this means free and easy wanderer. In other words, when the liver's uptight, the person is uptight. And what you do is you give herbs to help the liver qi to chill out and not be so aggressively rising. The liver qi is meant to stay here. And so for each of these types of patients, it would be the same herbal combination, even though the symptoms from a Western standpoint are different. Not the same diagnosis at all. Same Chinese diagnosis, different Western diagnosis.
I see. Now, are you just buying a bag of mixed herbs from some Chinese wholesaler, or are you going to actually go to the source and get the actual individual components?
I was honored and privileged to be treated by a doctor who would give me the little bags. Her husband was her office person, and so she would write the script, and then he would fill the little bags, and I would take them home and decoct one bag every day or every other day, whatever she said. I buy prepared herbal formulas for my patients. Most people these days have really busy lives, and they don't have time to decoct their herbs, right?
Yeah, I need to take a pill and go.
And also, there's some cultural things to be bridged. And we played with that in my household because I had a full-time job working as an editor, and I had 5 kids, and I was decocting these herbs and making dinner. And the kids were used to me, decocting the herbs, and I was suffering from a skin condition. And so I said, guys, you need to come and see this. They're like, Mom, we know that you're boiling that yard trash up there upstairs. And I said, no, this is different. Come on up and see this. And they looked and they said, Mom, there's bugs in your tea. I said, actually, those are just cicada shells, and they're for itching in Chinese medicine. So Chinese herbal medicine isn't always plants.
There's some insect parts sometimes.
There can be insect things, and there can be things that are really not favorable to endangered species, and so
right.
attempts
Don't
to
want
cut
to
back
use
on
those.
that. But even in Western herbal medicine, I used to say fenugreek, flaxseed, and slippery elm. well, that's an elm tree. Well, elm trees are a rarity now
Right.
because of Dutch elm disease.
Right.
And so marshmallow root is a great sub for slippery elm. So we try not to use elm bark anymore. And we try to use marshmallow root that has pretty much a good substitute for that.
When I was reading, I also heard about gallstones. You can grind up gallstones into various concoctions.
Oh, goodness sake.
yeah, gallstones. You mentioned the cicada shells. Well, we should be able to go out and collect those now. We're in the middle of two broods.
Two broods in the Midwest, and they are crazy right now.
I wonder if they have any value.
They're becoming deafening.
Yes, they are deafening right now.
They are. They're valuable in Chinese medicine, and they are one of about, I think I heard on the radio, 1,640 insect species that are regularly consumed by humans.
Yeah. So actually, a number of years ago, there was a little scandal here. The local ice cream place made one batch of cicada ice cream, and it hit the news wires.
And the health department came.
Yeah, they made a big deal out of it.
Yeah.
So tell me more conditions that you might treat with herbs and what a scenario would be. I like this scenario.
Okay.
So we talked about high blood pressure. We talked about hot flashes.
Okay, let's talk about infertility.
Okay.
So if patients come to me and they've already been worked up by genius doctors. So if they come in and they say, my reproductive endocrinologist, Dr. Gill, says that it's not the guy, it's the gal.
Okay.
So then I diagnose her Chinese-wise. And if she has deficient kidney yin or deficient kidney yang, then I would use particular herbal combinations for that.
I love it. Give me some examples. And I'm glad you broke it up because there's infertility. Almost half the time it's the guy. I mean, which clearly you're going to treat him differently from her,
the gal,
and
right.
she can have a million different problems. So it's once again not one thing.
Right.
But let's say we got good sperm on him. Okay, so her and I've taken out whatever tumor or cyst is growing in her body, but she still has these issues.
Right. So if she has deficient kidney yang, we're going to use herbs for kidney warming. And I actually don't study what those are. I just look them up in my book.
Okay.
And to be honest, there's a wonderful book. And if I know the diagnosis, then I can go look at the different herbal combinations. And usually there'll be information there that'll say, for instance, if you give this to a patient and they have some kind of mild nausea, switch to this combination. Okay. So it's not like a one-shot cures all kind of thing. You Chinese diagnose the patient, and then you see which combination you think might be best. There's a man named Giovanni Macchioccia, and he wrote the beautiful textbook on acupuncture, an Italian guy, but actually I think lives in Great Britain. And so it's an English language textbook. And he talks in there about how to use the different diagnostic strategies in order to determine the diagnosis. And that, for instance, if there's not usually excess kidney yin, usually there's just deficient yang. So you want to boost the yang. You want to yang it up with warming herbs.
Okay.
So scutellaria, or there's just different warming herbs that we can use.
And how do you get them?
How do I get them? Oh, well, I'll tell you about Crane Herbs in Massachusetts.
So you can order. Is that a mail order?
I typically call and prescribe the herbs, or I can do it online, and I can say for how long I want the patient to be using it so that we don't have somebody just staying on this forever. Because
so it's like a prescription.
Herbal medicines.
Duration.
Oh, yes, absolutely.
Root.
Right. So herbal medicines are medicines, and they work. So you don't just keep doing one thing just forever.
Right.
Even when I'm clear with patients about, okay, let's do it for this long, and at least email me or text me and let me know how you're doing so I can decide whether we're going to go on with this. But usually if people are really serious, they're also going to come in for acupuncture, and I can just review that with them at the time. And I also teach them Qigong, because Qigong, acupuncture, and herbs is like a royal road to helping many people to regain their fertility.
That's really important. That's really important to know, Sue. And for those listening to just this episode, we have separate episodes on all 4 of these topics here, where you've been kind enough to share your wisdom on these things. So they can all work in harmony. You need a doctor or a practitioner who has experience in all these things and can evaluate you as you evolve and as things change, and something might not be tolerable or not. So I've just learned from you that you can order these herbs or these combination of herbs from respected places that you trust. So you trust the herbs are coming from, are going to have in them what they say.
I use Taiwanese herbs, right?
Use Taiwanese herbs. Those are your favorites.
Yeah.
And there are places, and you mentioned one place here in the United States. Are there other sources for
there certainly are, and herbs are in an interesting place in the U.S. right now. I listened to a medical podcast recently where they were talking about giving melatonin to children, or even to adults, and that they reviewed 30 products, and that only 2 of them delivered the amount of melatonin that was promised on the label. Either
my goodness.
over or under. Okay.
And that's the big complaint modern medicine has with herbs. They say, well, you don't know what's in them. You can't verify how strong they are, the potency. Unregulated. You don't know the potency. But we're having the same problem here with over-the-counter. Now, I assume if it's a prescription medicine, they say there's 50 milligrams in there or whatever the drug, it's going to be fairly accurate. But these other things, such as melatonin, highly inaccurate, you're saying, when they're actually assayed. It's tested.
Right. So it's important to, for instance, when people are buying herbal supplements, to look on the label for the good manufacturing seal.
There is such a thing.
Yes, because what that means is that you'll pay more for these because that company hired an independent evaluating company to come in and test their products before they sell it to you.
That sounds really important. So
it's really important.
In the fertility world, it's real important. My lab is certified. I pay big bucks and have quite a lot of headaches to be inspected and certified for what we do.
So that's why I guide people initially, if they're interested in pursuing herbal things, I often guide them to start with one herb. Start with one. Fenugreek seed is unregulated, but the chance that it'll be so different from fenugreek seed in another state is small. It's fenugreek seed. Let's hope, that it was correctly grown and harvested and all that. And the differences are not going to be critical. They're not going to swamp somebody's boat. They're not going to make somebody sick.
You're not going to overdose.
The only exception is if somebody is allergic to it.
Right.
But with anything like that, we don't know until we've tried it. So far, none of my patients has been allergic to fenugreek. But, that doesn't say that no one is.
So we've talked about fenugreek, peppermint, chamomile. Are there any? Tell me a little bit about the other common herbs that are used. Tell me a little bit about ginseng. Everybody hears about ginseng or sang. I know in the Appalachians they called it sang because they sang harvesters looking for American or Western ginseng. What is ginseng used for, and how do you use it?
Ginseng is for boosting the qi. Okay, so it's not so much about yin and yang per se, although different kinds of ginseng can be more yang boosting or more yin boosting. Korean ginseng is supposed to be extremely yang, okay? Chinese doctors use ginseng to boost the qi. So this is a person who maybe is overworked, or they've had many babies if they're female, or they're just getting depleted in general, so that their whole constitution is starting to decrease. You might use ginseng for a short period of time. A lot of martial artists use ginseng, so they have lots and lots of energy, lots of qi, right? You know, I don't do that. I don't recommend that people do it, but it does have a role. And then American ginseng, most people regard it as not as potent as Chinese, but that can be a good thing. You might want a milder version for a young mother, like my young mother I talked about in a different podcast with you, who was just so depleted and cold. She said, I can't warm up. She had, lethargy. That would be the kind of person you might use some American ginseng for a short period of time, maybe a week or two, and see if that helps her.
Now, how does one consume ginseng? Is it a powder and a pill? Do you make a tea out of it?
Lots of ways.
Do you concoct it, decoct it, tincturize, extract it?
If you're lucky enough to have some amazing, beautiful, like fresh Canadian ginseng, for instance.
It grows in Canada.
Oh, yeah, and there's some pretty nice ginseng in Canada. If you're lucky enough to have that, then you're probably going to decoct it because you have the whole root there. Let's say you're me and you're in Midmo and you need some ginseng. You might be able to find some good quality ginseng in a Chinese medicine store or a Chinese grocery store, but most likely you will find it as a powder that you would order online or at a Chinese pharmacopoeia if you have access to one. So, if you live in a city that's large enough that has a Chinatown, you will probably have multiple choices about how you're going to prepare this. And you really should, with ginseng, it's my opinion that you should ask an Oriental medical doctor about how to dose it and what kind.
Okay.
It is highly stimulating, and that might be great, and it might not be great, depending on what your diagnosis is. So if you tend to be very young to start with, making you more young can actually cause like vacuity and emptiness. This is a Chinese diagnosis inside, where heat, pathological heat, comes, and then you get heat diseases, like you get skin disease, or you get heart disease, or you get, stuff like that.
So you need to know what you're doing.
You do.
With this kind of stuff.
So that's why I do the herbs that I do, because I was not a doctor when I was a young mom. I was a young mom staying home with my kids. And I just was learning 1 or 2 herbs at a time and using them for myself, and then seeing how they worked with my children. And an herb that I left out that I really like, that's had a really checkered history in the United States, is Lobelia inflata. And Lobelia inflata is an amazing herb, and it got a bad name around the turn of the 19th into the 20th century because people were using it. It's a tonifier of the colon and the lung. Now, are we talking about something that we know about in the West that actually corresponds to Chinese, where colon is the yang metal and lung is the yin metal? Okay, it'll tonify them both. And if you take too much of it, it makes you feel sick to your stomach. Okay, makes you nauseated. So medical doctors were not very happy about the successes that other doctors were having using Lobelia with their patients, because you can see there's a lot of indications from bowel function all the way to pneumonia. I'm not saying that would be the only thing you would use for someone with pneumonia. I'm just saying that at that time there were no antibiotics, okay? So we're looking for ways to help the person survive this, and we might use mullein, and we might use lobelia, and we might use a number of other things that are immune boosting. Initially, we might use echinacea for a few days. There's just lots of ways to approach this. Anyway, certain physicians who weren't using herbal medicine got upset because the other doctors were having success, and so they tried to outlaw lobelia. And it's been inlawed and outlawed multiple times in the 20th century, and it's not outlawed right now. But it's a plant that grows abundantly in the wild in Missouri and in much of the Midwest.
What does it look like? Is there a common name for it?
It's called Indian tobacco sometimes.
It's got broad leaves, like green leaves?
It doesn't.
Oh, it doesn't?
No, but it was called Indian tobacco, referring to Native American people, because sometimes they would smoke it. And that, too, would help the lung, right? So there's lots of ways to use herbs, is the point here.
Right.
I usually use extract of lobelia inflata, roots and leaves. And what that does is it helps mothers with babies with colic. I wouldn't give it to a neonate. I would give it to a nursing mother. And just the right amount would get into the breast milk.
Breast milk.
Besides, if the baby has colic, maybe the mother's got a gut issue too, and we can help the mother to make milk that isn't going to cause so much colic with the baby, along with, very super gentle osteopathy for the baby in places that are related to GI function.
Oh, wow.
And cranial can also be helpful for this too. So that would be a lobelia thing, all the way up to, somebody's coming down with a cold, get them on a little echinacea, get them on a little lobelia. I used to put drops of lobelia extract into my kids' apple juice because it's it'll put hair on your chest. It doesn't taste good.
Gotcha.
And so you would just put drops. Like I would, for a child, I would maybe put 3 drops in like 3 ounces of apple juice. And then they don't taste it.
Right.
Because I would use an extract in apple cider vinegar rather than alcohol. So we didn't talk about that aspect of herbal medicine either, carrier things. But so that's a way to use that along with other herbs. If it's a respiratory infection, they've probably got some mucousy stuff. So our old friends, fenugreek, flaxseed, slippery elm, a little bit of lobelia. Please don't use these herbs without talking to somebody who,
this is not
and getting good information.
Yeah.
You don't want to give too much lobelia. Most people will be stopped with whole herbs like fenugreek, flax, slippery elm, or peppermint just by taste. They'll say, no, 1 cup was enough, or 2 cups were great, but I don't want any more, kind of thing right now. So there's an inherent sense of that's enough for now. But when you have an extract, it's more potent because we've extracted the herbal virtue into this carrier like alcohol, glycerin, water, apple cider vinegar.
Yes.
And now it's got a bigger punch, so it's more of a tool that you want to be able to wield carefully.
Yes, it sounds like experience is really, really important here.
It is.
Wow. Well, Sue, I are there any other major herbs that we haven't talked about? Any other?
Oh my gosh,
top of the line?
So many major herbs.
I guess that's the wrong question. Tell me 2, 3, 4 more herbs that you commonly use.
Okay, I love jewelweed. And
we have jewelweed around here by the river.
Yes, you do. When I walk on the MKT trail, the jewelweed blooms so beautifully in the later part of the summer. And I thought about harvesting it last year for 2 things. One is poison ivy,
right,
and the second is any itch.
Right.
I have a tendency to have attack blood, so when I get bit by a mosquito, it's like my husband used to say, well, that one looks like the state of California, right? I mean, I get big wheals from mosquito bites. But if I put jewelweed spray on there, man, it brings it down pretty quick. And let's see, what else should I tell about? Oh, catnip. Catnip spray is great for insect repelling. Do I recommend it if you're going to go into a woods loaded with ticks? Well, I think you need something heftier.
Right.
But if you're just going to go outside in the garden and try to keep the mosquitoes off, catnip spray is a nice way to do that.
Neat.
What else? Aloe vera. Oh my gosh.
They put that in everything. You can even drink aloe. It's not poisonous to drink.
No, it isn't. But if you drink it, be prepared to have a loose stool after a certain point. And that's why some people do drink it.
As a laxative, as a safe laxative.
So just be sure that you know what you're doing. And absolutely have an aloe vera plant in your house. Mm-hmm. Nothing is better than aloe vera if you accidentally get a kitchen burn. If it's a serious burn, by all means go in and be seen and taken care of, but get some aloe on there. That's really going to help with minor burns that you get in the kitchen. Oh, and one of my favorites, minor cuts.
Yeah.
Ground cayenne pepper, just draw a thin line, just dump a little bit of cayenne pepper on there. Clean up the overspill so it doesn't get into people's eyes, noses, etc. It'll stop bleeding right now.
It's a hematinic. Right?
And it doesn't burn when you cut. It only burns on mucous membranes.
I'll be darned. So cayenne pepper, the stuff that you have in your spice rack,
right,
can be used for that.
Yep, all those things in your spice rack are herbs. So when you use culinary herbs, that's a form of herbal medicine. Again, we're getting back to food as medicine and medicine as food.
Of course.
We only want to use herbs in a medicinal way when we have to. What we want is just to stay well. Yeah. And so herbs help you do that too. That's why in my garden at home, I have a tiny little garden for pollinators, and I got my culinary herbs, my thyme, my rosemary. I've got my basil. I just got my little culinary herbs that I use all the time.
Well, that's fantastic, Sue. Well, listen, we could go on and on and on about this, but I think what we've learned is that generally safe advice from an experienced physician or herbologist or someone that has experience in these is really, really crucial.
Right.
Getting good ingredients from respected sources or your garden is important. And that's something we can all learn about. And it's something that we've all been doing. When we go to our spice cabinet, we've already been doing it.
And anybody who wants to get granular, you want to do a deep dive, get Carrie Bone's book, Phytotherapy. There's also a book called Medical Herbalism that is a good book as well, just to give you background. But by all means, just chewable chunks. Have fun with it.
Fantastic. Well, I've had a lot of fun talking to you about this topic with you, Sue. Thank you so much for all your wisdom on all these topics, and it's really been nice having you on the show.
Thank you so much, Gil.